Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today's topic is the benefits of a dedicated concussion clinic. And joining me today to talk about this is Dr. Sylvanus Lee with the Orthopaedic Clinic in Shreveport. Thanks for being here, Doc.
Thanks for having me here.
Absolutely. Okay, so you are at the Orthopaedic Clinic in Shreveport at the Portico location.
Correct, right across the street from the Piermont Hospital.
Gotcha, yeah, really easy to find you. So tell me a little bit about what you do as an orthopedic doctor.
All right, so I'm in the clinic a non-operative sort of sports medicine perspective where we can help diagnose injuries, but also go down the line of non-surgical treatment options where we can do maybe some therapy approaches, maybe some medication approaches or injection-based therapies, and maybe even some supplementation that helps out with your symptoms, get you functional again, get you playing your sport, whatever your sport is, just shy of surgery. And if your condition approaches surgery by any means, then I kind of bring you out to one of our colleagues over there that can help with that surgical intervention.
Love that, yeah, and especially because I think that surgery is a scary topic, so it's great to have these options beforehand before you do have to consider that surgical implementation or intervention.
Right, and I oftentimes think of it as a big kind of joint discussion, and that's the kind of conversation that we'll often have is, hey, what are your goals for? What are we doing? Is it more of a pain thing? Is it more of a functional thing that's stopping you from getting to where you want to be? Why are you seeing me here today? Is it a concern that we can just give you some reassurance on? Or do you want to be able to do a certain thing? And then we try to get you there non-surgically as best as we can, but sometimes it does end up having to go to a surgical intervention.
Right, yeah, gotcha. And then do you also help with maybe post-op patients as well? Or
not as much. There are times where people will come in a long time after a surgical intervention, maybe have some complications or some difficulty getting that strength back. We might get them through a little bit more therapy, kind of strengthen them a little bit again. But after surgery, usually the surgeons kind of like to kind of hang on to people who do their surgery on.
Yeah, okay, so, and it makes sense too because, you have like the therapy option, so do you kind of work closely with physical therapists or recommend similar approaches?
Absolutely.
Yeah.
So what we have, our favorite therapists are the ones right downstairs from us at the Portico Center. We refer all the time to them. We send them faxes, we send them a communication about what our concerns are, what the patient goals are. And their first visit is usually reviewing what our concerns are diagnostically, going down the line of where the patient is, where the patient wants to be, build a treatment goal plan of getting them there, kind of like a bridge, so to speak, functionally. And if they can reach that through their therapy goals, then we stay in contact, me and the therapists. And then oftentimes, we'll have to help them out a little bit to get through the therapy, but a lot of patients can get through that on their own.
Nice.
Yeah.
Well, very cool. So if you're just joining us, today's topic is actually the benefits of a dedicated concussion clinic. So we're going to be talking about that, maybe first explaining what a concussion is and those symptoms. Maybe some people out in our audience have had a concussion and they don't know maybe some of those symptoms and warning signs. So maybe break that down for us. What is a concussion and what should we be worried about?
Sure. So concussions, they're kind of complicated and they've kind of shifted over the last couple of years. So it's understandable why it kind of feels a little confusing. There's labels that used to be there and now they're kind of gone. And so the most recent agreements, I'll say, is that it sits on this spectrum of injuries to the brain that we call traumatic brain injuries, right? So they used to put them in categories of mild, moderate, severe, that sort of thing. We've kind of taken those labels away just so that we take each one as seriously as it ought to be taken. And so truthfully, it is an injury to the brain where the brain, you can think of it sort of like a bruise on the brain, and it can affect a bunch of different functions for patients. You get this constellation of symptoms. So you get a bunch of issues with headache, pressure in your head, sometimes nausea, vomiting, some dizziness, difficulty focusing. It could start messing with your sleep. It could start giving you mood issues as well, irritability, some anxiety, some depression associated with it as well. Loud sounds, bright lights really bothering you and getting in the way of any kind of performance, whether that's a high school athlete at school or an athlete going out and trying to participate in sport, which we probably ought to hold them off from.
Right.
But it's a constellation of these symptoms after an injury that, usually you get, it's a big impact type of a deal. Anything from I got my bell rung to a car accident where your head kind of whips, seems to be more vulnerable with rotation sort of injuries where your head twists and has an impact at the same time. Or any of those impacts where you come down and then bounce back in the other direction seems to be the biggest sort of risks for it.
Yeah. Okay. Gotcha. And so you mentioned college or high school athletes in general are kind of the high risk just because they are in that environment a lot of times. And but who are some of those other groups of population in our population that are also vulnerable to a concussion?
I'd say any contact sport is probably at the highest risk. So you think oftentimes football, you oftentimes think lacrosse as well. Soccer, a big one. Volleyball, also a big one. Really, a lot of high school, college athletes. But also other vulnerable people that we see and we also take care of for concussion constellation symptoms, people who fall in the parking lot and just kind of hit their face on the wall or hit their face on the floor on the way down, people who get into car accidents, people who, a storm rolls through and a tree breaks through their house and smacks them on the top of their head, and they develop these, this constellation of symptoms, days after, or, their other injuries were taking precedent as more important injuries, and then now finally they can address the other weird symptoms that feel like they don't mash together very well. I think truly any of those, and then car crashes, Shreveport, it happens often. So anybody who gets into those high impact sort of injuries are at risk for sure.
Yeah, and so what would you suggest, we're kind of talking about the benefit of a dedicated concussion clinic, so why do you think that is important and what would that focus on?
I think for the athlete, I'll start with that and then kind of go to the others. So for the athlete, really the big important thing is recognition of what it is so that we can make sure that our athletes stay safe. The issue oftentimes comes into play is that if we don't recognize it, we don't diagnose it appropriately, then we start going into, well, let me just get them back in, and that leads to quite a bit of consequences, second hit phenomenon, post-concussive syndrome are two real big things that can happen when you mismanage concussion. Truthfully, also, having someone who's familiar with what the constellation of symptoms look like, and also is pretty adamant about, hey, you're not playing anymore. I'm going to pull you out. I'm going to talk to your coach. I'm going to talk to your athletic trainer, and really hold you out for your safety, for your protection. Not only to get you in sooner, faster, safer, but also longevity-wise, 40 years down the road, we're not dealing with these chronic sort of issues.
Right. And are there not many dedicated concussion clinics that you know of around the area?
Yeah, not so much in the Shreveport area. It's an area that I think is definitely underserved. It's an area that I think in the area of Shreveport, even Bossier, has a little bit of less presence of specialty care for. So it's something that we're definitely trying to work on and fill in a gap for definitely patients who have a need in trying to get back into their sport safely.
Yeah, okay, good advice. So Healthline 3, if you're just joining us, is where we like to focus on ways to live a healthier, happier, and pain-free life. And we've got those phone lines open. That phone number is right there on your screen, 318-219-4569. And we're going to be taking your calls and answering any of your questions about concussions or any of those, as you mentioned, the constellation of symptoms and maybe treatment options. And so we have those phone lines open. Give us a call, but when you do call, make sure you're in a quiet room with your TV turned all the way down so that we can hear your question. Okay, so on the flip side of that, we just talked about the benefits of having these clinics. So what happens if you don't manage or treat a concussion properly?
Some scary things, truthfully. So the first one you think of is when you don't catch it, you don't know what's going on, and you just kind of go on your merry way pushing through life. And we call that post-concussive syndrome, where you don't really tone it down, don't give your brain the certain amount of rest that it needs, you don't accommodate the brain for its certain needs, and you just push through, which is a lot of times what athletes are trained to do. You push through the line, you knock someone out, you lay down the line, but you really got to pull away from that. And when you push through too hard and you keep pushing through life, because life happens and you got to keep moving on, you're left with these chronic symptoms. Almost the constellation of symptoms start to evolve over time and manifest as part of what you think is a chronic issue for you. The second thing that we get concerned about oftentimes is something called a second hit phenomenon. That's where you're hit with the first concussion, you get sick, you don't really pull yourself out, you go out there and play again, get hit by a second concussion, and you have a constellation of worse symptoms for much longer. Sometimes a course that might have lasted 2 weeks or so ends up lasting months.
Right.
I used to work over at TCU, and we had an athlete over there have symptoms for over a year after getting hit pretty darn hard by a horse on the equestrian team. So your risk is not zero, even with horses.
Right.
But both of those are really big concerns, and so recognizing it and having more publicity about it, more knowledge about it in the general public is good things. But getting in to see a health professional to really address the different aspects of what your symptoms are really, really darn helpful in those aspects.
Yeah, okay, and so you are more susceptible, you'd say, after you have a concussion to getting that, what did you call it, second
hit phenomenon. Yes.
You're kind of more at risk for that?
Absolutely. There's a not zero risk for if that second hit phenomenon happens before that first concussion resolves, that there are cases where people just flatline, and that can happen on the field. You have really scary signs and symptoms that happen around that time. You can look kind of towards those scary NFL clips whenever you think about that.
Yeah. So even if you're hit in a different place on the head, or does it most of the time you almost have to have that phenomenon happen in the same place?
That's a good question. I think that's one of those avenues where we don't quite know as much.
Right.
I would anticipate it to be in a similar location in the head, but there are global brain-wide chemical changes that do happen whenever you have a concussion. So it might not have to be the same place.
Okay, gotcha. Yeah, this is pretty interesting stuff. I feel like we as a culture are more aware of concussions and the just the real consequences of having them. Maybe more so in the last couple of years. I feel like maybe we didn't really know much about it. Would you say this is kind of more up and coming? We're learning more every day. Absolutely.
I feel like I'm learning and reading more and more about it, and it kind of shifts every 2 years or so. So staying on top of it is part of what keeps me an enthusiast for it. Specialist is a strong word, but you just stay on top of the research as best as you can, and try to have the most current evidence for maybe what treatment options or supplements or treatment modalities you have available for it.
Right, okay. So I think I would wager a guess that most everyone has probably hit their head on something at some point. You just stand up too fast and you hit it, on something above you that you didn't realize was right there. So when should you be more safe than sorry and just go talk to a specialist immediately, or when should you worry? Those days after, as you're kind of looking at those symptoms, what would you give someone advice on if they just recently, hit their head, banged themselves up recently?
Yeah. This is something that we face a lot of the times on the sidelines when we're covering sidelines of Willis Knighton with a couple of the high schools in town. When someone hits their head, is this just, did they just hit their head, or are they dealing with concussive symptoms, which kind of relates to, hey, I hit my head on maybe a bunk bed or something like that. Do I have a concussion, or did I just hit my head? I think the body is pretty resilient to a certain extent, but you really got to keep a keen eye out for really the symptoms here. And they can develop fairly quickly with a pretty traumatic injury. And in anywhere from about 15-20 minutes, you can develop worsening of symptoms of headache, pressure in your head, almost attitude changes of irritability and tearfulness that will happen a lot of times on the football sidelines. So we'll recognize a lot of that. And sometimes there's this almost sheen look in the eyes that you can kind of recognize. I kind of describe it as the difference between a plain donut and a glazed donut, right, over the eyes, and you kind of just recognize they're just not quite focusing on you.
Right.
And so, they can develop in 10-15 minutes. It can also develop a day or two after you had your head injury. I think the persistence of where your head symptoms are or what symptoms you're experiencing really kind of lead into that clinical diagnosis.
Okay, and as you mentioned, this is something that you're very passionate about, so you feel like sometimes when you're on the sidelines you can kind of tell almost immediately, or maybe within those 15 minutes you can give a pretty good guess?
There's a pretty good gestalt feeling associated with it, but you can't just go through medicine with gestalt feelings,
exactly.
right? So there are a couple of specialized tests that we do, testing, things that we know are affected with head injuries and concussions, right? So balance, vision, eye motion, attitude changes, memory, all of these things kind of come into play and are affected to some degree. It can be helpful to get baseline testing for some of these patients. They do that at the collegiate level. But just kind of getting an idea of what their reaction time is, their eye movement time. If any of those tests that we do seem to flare up their symptoms even worse, we know that these certain areas of their brain is affected by the injury.
Gotcha.
Yeah.
And I think for a long time, you hear things all the time like, don't do this, don't do that. And I've heard, over the years, don't go to sleep if you think that you have been concussed. Why is that a thing?
Yeah, that's a good question. I think that comes into the acute head injury in general. There are scary things that can happen with head injuries, like brain bleeds. And with brain bleeds, we get more concerned about a couple of different things. A sudden, what we call thunderclap headache, where your headache goes from, oh, it's nothing, boom, worst headache of your life. Suddenly you're developing neurologic symptoms like weakness on one side versus the other, a difficult time speaking, true vision changes, not just eye movement speed and flare up of pain and discomfort, but true vision changes like blurring or double vision and things like that. I think those instances, people are much more safely evaluated in the emergency department, get a scan of your brain. I would say from a general standpoint, if you don't have any of those really concerning neurological symptoms, you can manage it without any special type of scans or anything like that. But I think when we talk about head injuries and don't go to sleep, we're really generally worried about the brain bleeds that can occur, because you'll be fine, and suddenly, boom, your headache is the worst it ever was, and you're developing these neurological symptoms. And the don't fall asleep is just to be awake and aware from whenever that happens. Generally, after a couple of hours from when the injury occurred, you're fairly safe to go to sleep. In fact, one of the big things that we encourage whenever you do have a concussion is to regulate your sleep.
Right. Okay. Yeah. Sleep's very important. Yeah. Okay. Yeah. Thanks for clearing that up. I know that that's something you hear and you're like, well, why is this suggested? And that makes sense because you want to monitor those symptoms and looking for, as you say, the constellation of those symptoms and if they worsen. So let's say you have an athlete who doesn't want to get a concussion. They are involved in contact sports, so their risk is increased. What would you suggest? What piece of advice would you give them to best protect themselves?
Right. There's a lot of research on this.
Okay.
This is, I think, a multi-million, if not billion-dollar industry trying to find things that help prevent concussions, anywhere from neck braces to different types of padding under helmets to different types of helmets to different techniques of tackling to different types of supplements that are out there. As of yet, the biggest thing that seems to have made a difference is the helmet itself. All of those other equipments that you see out there that are hundreds of dollars don't seem to make a huge difference as far as the obtaining a concussion itself, unfortunately. There are also supplements out there that people promote to be brain health, neuroprotective, or protective of the brain. And getting you into a place that might decrease your risk. I don't think the research is quite out there yet, so I can't really encourage that.
Right.
If you do kind of proceed at your own risk, that sort of thing. But generally, I will say appropriate tackling technique. Make sure that you're also not spearing head down into somebody. Do your best to avoid a specific type of rotational impacts. I think a lot of the time you ought to have a real solid conversation with any kind of contact athlete that, hey, this is a real issue, this is a real risk that you're running here. Make sure that you're doing your sport right, one, two, recognizing these symptoms and addressing it sooner rather than later whenever you do develop the symptoms, and then almost manage it retroactively.
Yeah, okay. And the whole topic of what we're talking about, a dedicated concussion clinic, I think that really does kind of prove to your point that having professionals like you to bring awareness of how severe it can be. Of course, people that are in contact sports, I'm sure that they know, but it's always good to be reminded of those best practices.
Right.
Yeah.
Right. Absolutely.
Yeah. Okay. So I have another question. So you talk about the supplements as far as the treatment, and we just talked about the supplements for preventative. There's not a lot of literature that support that.
Right.
But the supplements from the treatment end, can you speak to that?
Absolutely. So there's some evidence that certain amino acids are pretty helpful in the acute phase after you just start developing symptoms of a concussion. Potentially bringing you back a little bit sooner. So having the appropriate protein intake, so that's something that we recommend for all athletes, not just ones who have had a concussion. You got to repair from all the damage that you put into the body,
right.
build up the muscle and everything like that. So you should be on an adequate amount of protein to begin with. Second thing seems to be fish oil. It's an interesting one. It's not necessarily the fish oil itself, but one of the molecules in the fish oil that's in there that seems to be a little bit more neuroprotective or an anti-inflammatory specifically within the brain, and seems to have some promising evidence. That's one of the things that we're, I think, an avenue of research for sure.
Yeah.
Third one is creatine. You'll see that one often used as a supplement for any kind of athlete, for muscle growth, hypertrophy. It helps a lot with cognitive function as well. You'll notice if you look into the research for creatine monohydrate. So that seems to be one of the other supplements that we can add on board that might kind of expedite the recovery time for you.
Yeah, very interesting. Okay, and so that's something that you would discuss in your clinic and maybe you would recommend to kind of help get back on track. Any other medications that are recommended or therapy techniques?
Right. So one, I say, avenue that we oftentimes go down is trying to fix your sleep. Melatonin is a really helpful one for that aspect. I use it myself. Whenever you're sleeping off cycle, going to travel or anything like that, getting your sleep cycle back on board. So if you're having sleep disturbances because of the concussion itself, which is a very common symptom, getting your normal sleep, I call it the long sleep at night,
Right.
not messing with it by playing with your phone or, taking naps throughout the day, reserving that fatigue or that sleepiness towards the end of the night so you get that good long sleep at night and regulating that with the melatonin. So that's another one that we'll use pretty often. As far as therapies, like treatment sort of modalities, I think there are certain prescription medicines that I'll use, and they really kind of have to fit the right person.
Right.
So just having that discussion on where you are, what your symptoms are, really kind of leads you into that, being a candidate for it. And then the last one, therapy is truly doing things, physical things. A lot of the times with concussions, you get something called trauma-induced vestibular dysfunction, which is you get hit, and this balance portion in your brain gets kind of thrown out of whack. And so your eyes and your ears are telling your brain different things, which kind of send you all this kinds of disoriented.
Gotcha.
And doing that, doing some sort of therapy with a trained physical therapist called vestibular ocular therapy seems to be one of the best things that you can do to kind of sync it back up. So you're telling your brain the same things with your eyes and your ears.
Very cool, yes. And I love that you mentioned, you kind of harp a lot on the sleep.
Yes.
Because, sleep, I feel like, just repairs a lot of the things that you damage during the day, kind of cleans house, if you will. But I feel like the brain, it just does a lot of good things for the brain, and maybe even preventing against like dementia and Alzheimer's later in life.
Right.
And I don't know if this is a stretch, but do you feel like if there's any research that suggests people that have had concussions or traumatic brain injuries are more susceptible to Alzheimer's, dementia, or anything else later in life?
I think there's a lot of wisdom in that question, actually. The most recent research shows that whenever they take autopsies of people with what we call chronic traumatic encephalopathy, which is the consequence of repeated concussions over years, to another consequence of just personality changes, aggression, forgetfulness, all those sort of things that you'll see in contact athletes down the road in their 50s and 60s and things like that.
Yeah.
They'll take autopsies and they'll find an abundance of these proteins called tau proteins. And those tau proteins are a key marker in a couple of diseases like dementia as well as Alzheimer's. There's only a few conditions where those proteins aggregate and collect inside the brain. So similar, it's the same protein in both of them. So I wonder if there's more of a connection than we have always thought there were.
Yeah, and like you said, we talked about earlier, I feel like this topic is growing more interest, and it's not as maybe taboo to talk about. I feel like several years ago, it was like, that doesn't happen, and so I feel like maybe now, hopefully, moving forward, we'll be able to really see if there's a link,
Right.
That's really scary. But
Yeah.
go ahead.
I mean, oftentimes that's what a lot of my visits are. Really, you take it serious, right?
Yeah.
This is something that you're going to have one brain. You're going to live with one brain for the rest of your life. You know, I say this to a lot of my athletes who come in and they're real agitated and anxious, saying, "Hey, why are you holding me out?" That kind of thing. I want to go back. I say, "Hey, listen, if you busted up a kidney, I'd say, sew up that kidney, go back out there. You got two." But for these, you only got one brain. You got to live with it for the rest of your life, and it'll, only get worse if you don't treat it right. So,
Right.
yeah.
Yes. Okay. So talk about, you mentioned CTE.
Yes.
And just kind of a consequence of having maybe a chronic concussions
Yeah.
or injuries to the brain. So tell me a little bit about that and maybe symptoms that some people live with, and just the worries behind that.
Right. So this is something I also harp on for my student athletes as well. A lot of kids out there, they're doing this for their family. They're going out, they want to play football, they want to succeed, go big, do it for the family. And so a lot of the times I'll harp on them and say, hey, listen, you look at these guys who are not being managed appropriately, and what is the outcome? And they're not being held out from the sport and going through the right protocols to get back safely. You end up with subsequent concussions. You end up with potentially that second hit phenomenon where you're dealing with these symptoms long term, or you're dealing with something that is kind of creeping and getting better, getting another concussion, creeping, getting better, getting another concussion. And it seems that these subsequent concussions have a cumulative effect on the brain, and then not being able to evacuate all these proteins appropriately. There's a protein that seems to build up in the brain an amino acid that builds up in the brain called glutamate. Seems to be a key player in the metabolism of the brain. All these things that'll change from a chemical level over years leads to these protein buildups that you do get concerned about. You hear about on TV, and you hear stories about where people have personality changes. They're a different person than they were coming in. Their memory starts to fail them. They start to develop, like you said, Alzheimer's symptoms early on, 50s, 40s, when they're just leaving their sport from a professional level. Signs of aggression, and functional decline, where they're not able to do normal everyday things to the normal level because of these chronic or repetitive injuries to the brain. So I say, take it all the way back to each individual concussion and really treat it accordingly, treat it the right way, so that when you go out and if you're doing this for mama, you're going to remember who mama is at the end of the day.
Absolutely. Yeah, that's a great perspective, and I think that's probably hard for student athletes, probably a hard conversation that you have to have, because, when you're in high school, you're not thinking about when you're older and, your memory and stuff. You're just like, just put me in, coach,
That's exactly right. That's exactly right. It's a conversation we have very often, actually.
Okay, gotcha. Well, we have just a couple of minutes left, and, so you at Willis-Knighton at the Orthopaedic Clinic, this is something that you specialize in, and that's something that you said is underserved. So let's say someone's watching. So how would someone get connected with you? Is that a referral process, and are you accepting
I think it depends on your insurance. If you require a referral to go see a specialist, then you can. But if you have an insurance that lets you go see a specialist, just call in. They usually will have some kind of triage form letting us know what exactly your issue is, what are you dealing with, is it a concussion, or is it one of the other things that we treat here? And we get that paper in, see is it something that I do treat, and if it is, and if I can handle it, like we said before, without surgery or anything like that, we'll bring you in, call you, get you scheduled. It's a pretty seamless process.
All right.
Yeah.
And are you accepting new patients right now?
Absolutely, all the time.
Okay, good deal. That's good to know. Okay, so concussions, but also really anything else related to sports medicine, right?
Right. And I say your sport is anything. It can be, playing with the grandchildren. It can be gardening. It can be football. It can be rugby. Any of the above. Truly, you find your sport. I'm going to try to get you there. You're going to try to reach a certain level of excellence. I'll try to meet you there in that certain level of excellence. With all the different things that I have in my tool belt, for sure. And I say that those treatment options go anywhere from, hey, I injured myself, all the way up until surgery. I sprained my ankle all the way until, I need surgery on this or that. We've got you covered everywhere in between.
All right, good deal. Okay, and that phone number, we can find you at that phone number to your clinic that's right there on the screen, 318-212-3610.
Absolutely.
Is that correct?
Absolutely.
Okay, and then also at the Orthopaedic Clinic Shreveport.
Absolutely,
Okay.
yeah, in the Portico Center.
All right. Well, Dr. Sylvanus Lee, thanks so much for all of your expertise in concussions and traumatic brain injuries. It's been really interesting getting to know all this stuff. So thanks so much. And if you are wanting to rewatch this, maybe if you missed it or if you just wanted to rewatch it, go to ktbs.com/podcast or ktbs.com/healthline with the number 3.